first of all, do not ever use dental school terms. These are the terms they teach you to use in dental school. I would highly recommend, or, it would be nice if you could. Like, this is just crap that does not work or sell anything, because in dental school, they don't need to sell anything, right? So how do we remedy for this? And how do we do it so that way it makes your follow-up effective? Like you said, what do we do before the follow-up? Well, you guys all have to keep this in mind. And I want you to keep this visual in mind when you do anything that's going to motivate anyone to do anything. And some of you are going to cringe at this phrase. And some of you are going to feel like, God, Ranesh, we're not those people. We're not bad, right? But it's not a bad thing, because you're tapping into human psychology. And I always say you have to turn the knife. You got to turn the knife. Okay. And I was talking about this to a friend the other day. It's like, you're not turning the knife, man. Like, you need to turn the knife. What does that mean? Okay. God, Ranesh, you're telling me to stab someone and turn the knife? No, I'm not telling you to do that. But what I'm trying to tell you to do is you have to tickle their pain. Okay. So you have to get into their pain. Okay, what's their pain? They have the cavity. Maybe they're a little sensitive. Look, here's what I found. This is going to happen. You're at the movies, or maybe you're away for the holidays, and the pain can just kick into high gear. You don't want to be in a place where we're not around, you don't have resources, and that tooth starts throbbing in high gear, and it's now you don't know what to do with it, and now you have to do something with it. But even worse is that you don't have a dentist or you can trust, and you have to start turning the knife a little bit. Now, you do it in a good way where you're not looked at as the negative Nelly, but also someone that is like, hey, look, I'm here, I'm looking out for you, but then here's what you do. And how do you tie that to the follow-up? You have to take that knife turn and you have to use that terminology and in the follow-up. So I'm going to talk to you the way I'm going to talk to you today. I know how I'm going to talk to you today because I know what I'm going to do follow-up wise 2 weeks from today, right? If I know how I'm going to follow up on a case 2 weeks from today, I'm also knowing, like, I'm going to say this right now. So when I do say this now, it will also make sense in 2 weeks. So you have to tie those words together. It's like they're like tied through a long thread. So I'll give you an example. So like if you're talking about, a quadrant where there's a bunch of cracked amalgams, and you're like, look, I showed you these on the camera. Like these have these are not just micro fractures. These are like separations in your restoration. Like they're separated, they're cracked, and stuff's getting in there. And the problem with this stuff is when you bite down, anything that crumbles inside the tooth is also going to help crumble around the tooth, right? So I'm painting a picture of tooth crumbling, okay? But then when I follow up with them, hey, I know we mentioned this in our exam. We talked about this. I thought of you because we had a tooth that came in and it totally crumbled down. So, when you're ready, let's get you in. We have some time open for the next week after 2. Let's get you going. Notice that I'm also hitting on the pain, right? So this is a fine balance, but I can tell you, and Scott knows this through observing, is you don't want to use soft terms because they're not going to move the needle. They're not going to make it so there's a decision that happens. You want to use terms that are certain, that are firm, fair, but also that refine the image in the listener's mind. When you say stuff like, I would recommend that you get this tooth done, that does not refine the image in their mind. So what I always recommend is use terms that refine the image. I told you guys, twist the knife. There's an image there with that term. If I'm saying the tooth can crumble, there's an image there with that term. The more visual imagery you can use in your descriptions, it's now planting in the patient's mind. They don't even, instant. A picture is worth 1,000 words. It's also worth a bunch of feelings. So what I'm trying to have you do is pick some words. Mark said, hey, this is what's happened. This is what we've seen that's happened. And here's what you could do. Yeah, it's open-ended and it's good, but let me tell you, that philosophy on steroids, it's using just a few different words. Now, you can use those same words in the follow-up, okay? You can use those same words in the follow-up. And also, when you do follow-up, even in a soft way, the patient is going to remember the knife turn that happened in your office. Here's the one danger when you turn knives. You do not want to link that to their self-esteem, because now you made them feel bad as you did your treatment plan. And if someone walks out of your office feeling bad about themselves, they're less likely to come back to you because you don't make them feel good. So how do you remedy for this? Well, look, I know when we've seen this whole side, you have these fillings that are cracked. There's cracks in them. Things are getting in there. Teeth start to crumble when this happens, right? You've seen like dry chalk. You've seen like, even if you take a dry cookie, like it crumbles, right? That's what happens to the tooth when most of this filling in there is cracked. The tooth will start to crumble. So here's the thing. I don't want you to get like panicked over this, because we can actually fix it, right? Here's how we can do it. Let's get you in just for the first one, and let's just make it so it's easy. So that way it's done. So you don't have to worry about it. And you do that one and you'll feel better about doing the other ones. So now I'm actually giving them a solution and helping them feel better about their situation. Okay. So you have to future pace it with an outcome, but you also have to turn the knife a little. And if you can tie those things together with follow-up, then you've really made the connection. Okay. And this has to be in your terminology. Like you have to sit down with the doctor and say, okay, if you see a cracked amalgam, what are some terms that we're going to use that can refine the image in their mind?